Pertussis or whooping cough. So just a little bit about the disease. It is caused by the Bordetella pertussis bacteria, that is a gram-negative coccobacillus bacteria, and it can be characterized by a few things, one of them being a mucus accumulation in the lungs, which is what's being shown here, that mucus buildup, that gunk building up in there. And it can also be characterized by a whoop sound that is produced after a person has a coughing fit. I'll go ahead and play a little bit of what that sounds like for you guys here. So like I said there, that was just after that patient was having a little coughing attack, a coughing spasm, they have that whoop sound as they're trying to breathe with all that mucus buildup in their lungs. And it is pretty commonly seen in infants and in our children. The different scientific names. So the genus is going to be the Bordetella. The family, it is part of the Alcaligenaceae family. And after that we have the species, which is a Bordetella pertussis. The modes of transmission. So this is a disease that is highly communicable. It is through our airborne droplets, such as with our coughing and our sneezing. It can be passed on very easily with close contact with an infected person. An infected person can actually pass it on to 12 to up to 15 people. The different signs and symptoms. So we can have our fever, runny nose, sneezing, nasal congestion, a cough, vomiting, so kind of flu-like, cold-like symptoms. And you can also have things like apnea, which is seen in babies, paroxysms, which are those coughing fits that I just spoke about. Those are followed by that whoop sound, as well as a lot of exhaustion. And the symptoms have a wide range on when they can start developing after an initial exposure. So they can go anywhere from 5 to 10 days, even up to 3 weeks. And the coughing fits have actually been found to last up to 10 weeks, sometimes even more. And I will note that these different symptoms can actually vary by which stage of the whooping cough that patient is in. And I'll discuss those stages in a few slides here. And it has been found that with babies, they actually do not cough at all. It just causes them to stop breathing, and then they start turning blue because of that lack of oxygen. So some other effects of B Pertussis. So the bacteria actually grows and causes symptoms because of the exotoxins that are being released. One of the most important virulence factors of this disease is going to be the Pertussis Toxin, the PT, which is what this is right here, because it increases the CAMP levels, and that will actually disrupt the cell signaling. And it will also enhance an inflammatory response, and it does this with histamine and serotonin. And the B pertussis also produces a tracheal cytotoxin that will start damaging those epithelial cells, start damaging the cilia and the respiratory system. So this is a disease that really hits that respiratory system hard once it starts having all that mucus buildup and starts damaging all those fibers in there. So the different stages, as I mentioned earlier, the symptoms will vary based on what stage the disease you are in. So for starters, we have the catarrhal stage. These are those cold-like symptoms, the runny nose, the congestion. But this is actually when the B pertussis is most infectious. However, it is very hard to diagnose a patient with pertussis until they start showing more serious symptoms. Of course, if your child is showing cold-like symptoms, your first thought is not that they have pertussis. You're thinking that they probably just have the cold or the flu or something that's not so serious. And this will actually last about 1 to 2 weeks. Then we move on to the paroxysmal stage. This is when you start having that mucus accumulation in the lungs, those coughing spasm, the vomiting, and the whooping sound. This has been found to last anywhere from 1 to 6 weeks, sometimes even up to 10. Then after that, we go into the convalescent stage. This is where they kind of have that chronic cough. They have a very gradual recovery, but they still have that cough and a couple of the other symptoms going on. And this is actually when the patient is most susceptible to get other respiratory infections. And this will last 1 to 2 weeks. So as we can see here, we have 1 to 2 weeks, 1 even up to 10, 1 to 2 weeks. This is a disease that does take quite a long time to go ahead and fully play out in our body. Then we have the incubation period. So on average, it can be about 7 to 10 days, but it has been found that it can go anywhere from 4 up to 21 days. And like I said, it is divided into those 3 stages that we just talked about. So the treatment. So these treatments are going to be after that initial catarrhal stage, after those flu-like symptoms have gone, really. This is once we're more into those other stages, the paroxysmal stage and the convalescent stages, and when antibiotics and different antimicrobials are going to start being needed to help with some of those more serious symptoms. So for example, in those early stages, we have the erythromycin and the tetracycline. And the antimicrobials, I found that the most popular one, if you will, is going to be the azithromycin. and then different prevention. So I did not include it on here, but of course you also have the really obvious ones included: the washing your hands, covering your mouth if you're coughing, trying to stay away from those sick people, trying to disinfect all those contaminated surfaces, things like that that are pretty obvious. I did not include on here. I did include, however, the big prevention methods for these diseases, which are going to be the vaccinations, the DTaP and the Tdap vaccines. Babies are supposed to get the DTaP shot at 2, 4, and 6 months. And then after that, they're supposed to be receiving boosters at 15 through 18 months and 4 to 6 years old. Then once you hit those preteen years, 11, 12 years old about, that's when we switch over to the Tdap vaccine. And it is actually recommended that pregnant women get the Tdap vaccine in order to provide their baby with some short-term protection until they are themselves able to get that vaccine for themselves.